Hey, it's me, Dr. Barto, and I'm going to share with you in this video the benefits of resistance exercise. So, resistance exercise is obviously necessary for overall good health, but it is absolutely necessary as well for spinal health, which is why I'm sharing it with you in this capacity. Now, the great news about resistance exercises is that you do not have to go to the gym every day. What you need to do is, if you are exercising your large muscle groups, so like your arms and your legs, and you utilize whole body movement, then you really only need to perform resistance exercises 2 or 3 times a week, because recovery is equally important. So if you're going to move your full body groups and really work it hard, then you're going to need to rest, because what happens with resistance exercise is you kind of tear up your muscles a little bit, and then they need to come back together and heal and be stronger. So let's see, your time in the gym or at home or at the playground is, you can do this wherever. You just want to focus it. So if you're really focused and get the job done, you'll be done in 30 to 40 minutes at most, which is well within like the daily minimums of exercise needed. So we know that resistance exercises, so I'm going to go through a couple of things because I want you to really work on your belief system here, and that once you know how critical and believe with every cell in your body how important resistance exercise is for you, and that without it you absolutely cannot be healthy. Once you know that it's a requirement and you fully believe that, then it's much easier to change your behaviors. So we're not trying to just force you into doing something you hate. We're trying to force you into loving your body and caring for your body so that it can take you far in life. And we're trying to help you find ways to care for your body in fun ways. So that's why you don't have to go and like lift heavy barbells, dumbbells, I think. You don't have to just go lift that. You can go to the playground, you can have fun, you can do things at home that count as resistance exercises, okay? And this is why it's important. Resistance training has been shown to increase muscle mass in all age groups, so it's never too late to start, and it increases growth hormone levels. That slows the aging process and yields many benefits in all areas of life, like weight loss, appearance, sex drive, sleep, energy, and immunity, okay? So if the first 2 weren't good enough, the third one ought to do it for you. Get the spouse out and exercising with you, and then sleep, energy, and immunity are just nice benefits. So one of the most effective ways to prevent the development of insulin resistance, metabolic syndrome, and ultimately type 2 diabetes is to exercise large muscle groups with resistance training. So type 2 diabetes is like a major health issue in the US. So large muscle group strength training helps prevent that. It also is going to improve cardiovascular function. So it's not just aerobic activity that's good for your heart. It's going to improve weight control, prevent osteoporosis, because your bones don't get strong just because you put calcium, or whatever into them. Your bones get strong whenever they have impact on them. So you can resistance exercise like swimming, but that won't build your strength. But if you're out and you're running and you have that like force on your bones, or or lifting the weight and it puts the force on your bones, that will build a stronger bone at any age. Just because you've already have weak bones doesn't mean you can't get it back. You can do it, okay? Your bones are constantly reforming. They're always breaking down old material and putting in new stuff. Resistance, it also prevents injury, obviously. Okay. So in addition to daily aerobic activity, people should engage in resistance training and flexibility at least twice a week. So you're aiming for 2 to 3 times a week. It'll maintain lean body mass, so you'll look better, improve muscular strength, endurance, and preserve function, all which enable long-term participation. So in a trial of elderly patients with type 2 diabetes, performing strength conditioning program, muscle strength increased by 31%. In old people. Imagine what young people can do. If your muscles are weak and deficient prior to an injury that results in a period of immobilization, the acute loss from recovery period might mean that return to normal function may never occur. For example, greater than 50% of women older than 65 who break a hip will never walk again. So what that means is, like, women who are 65, if they were weak before the injury, it's hard to come back from that, okay? And I'm sharing this video a month after I broke my knee. So, you know, the good news is I wasn't as strong as I needed to be, I fully believe, or I wouldn't have done this injury. But because I'm not completely deconditioned, I have better chances of coming back from it than if I wasn't conditioned. So, resistance exercise. You want to work the full body, all your large muscle groups, including those of your spine. Lifting heavy stuff and doing squats and that kind of stuff is going to help you as a whole be better. So aim to lift heavy things 30 to 40 minutes twice a week. 3 if you're awesome.